The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, and welcome to our Socrates Lunch and Learn webinar on chronic disease management and the functionality that is coming soon to most of your Socrates systems, but in some of them now at the moment. My name is Donald O'Neill, and I'm the head of marketing for Clonwilliam Health. And with me today, I have Louise Murray, who is our support team lead for Socrates. The format of today will be fairly simple. We're going to do a quick run through and overview of the functionality. We're going to try and keep the whole webinar to about 30 minutes in duration because I know you all have lunches to eat and everyone is busy, but we will allow time for questions at the end. So if you do have any questions, on the right hand side of your screen you should see a little toolbar for the webinar system, and in there there's a questions tab that if you type in your question in there, it'll come directly to me and I can ask Louise at the end. So we'll let Louise do a full run through and then we'll try and get through as many questions as we can. So without any further ado, I'm going to pass the controls over to Louise and she is going to run through the functionality. So that should be on its way to you, Louise.
Yep, that's perfect. Hello, everybody. And right, so we'll start it off. So the first thing is about it before I even go into how to do it in a chart. The first thing that you need to have done before you can actually use the chronic disease management inside of Socrates is, one, you need to have your signed contract with the HSE. So if you don't have that, you need to get that signed. And once that's signed, the HSE have to kind of turn it on then that you are allowed to do a chronic disease management visit in your surgery. You don't need a PCR certificate, but you do need a HealthLink certificate on your computer. So if you already have a HealthLink certificate on, you would know, because if you download your bloods on the computer, if you do e-referrals, if you do e-cert, you'll know that it's there. And if not, if it's kind of you got on your computer, you can tell by opening up the Internet Explorer, and then you go up to Tools up at the top right hand corner, click on that and go to Internet Options, and from there you have Content and Certificates. So I have a Test HealthLink certificate on my computer, so that's how you can tell. It has to be in the Internet Explorer. If you have it in other browsers, that's fine, but you need it in Internet Explorer for it to work through the Socrates system. Right, so I will just minimize this for a moment. Right, so to start it off in the chart, so the people that will be on that can do a chronic disease management visit on, you have to be 75 with a medical card, a DVC card, and you would do it on someone that has diabetes, asthma, COPD, heart failure, AFib, IHD, and CVD. So day one, what happens is you bring the patient in. So my example patient is John Roberts. So in my scenario, because people that have been using it in the introductory phase, they have had a couple of questions, and one of them was, if you have a patient, for example, that was in hospital for a few months, and they're after coming out of hospital, and now they're coming into the surgery, and the doctor or the nurse or the phlebotomist doesn't necessarily want to poke the patient again because they've been through enough being in the hospital. So what happens is the patient gets sent back with a hard copy maybe of their bloods, so you don't have to do your bloods again if it was given in the last 3 months. So in that scenario, you would need to have, and I'm going to show you in this one here, but the main thing that you're going to have most of the time is you're going to do your bloods, they're going to come back. In this scenario, I'm going to give you an example of how to fill it in the system so that you can link that into the chronic disease visit. So yeah, to do that, we need to create an investigation in the background that you will add into the chart. And then if you do, for example, if you get back hemoglobin, LDL, HDL from the hospital, then you can fill in those results. So for our example, I've already created one, but I just want to show you what it looks like. So I go into my control panel, admin console, and investigation. So I have created one in here called non-electronic results. I've created down here by just typing non-electronic results, and then I go save, and it goes over here. Then these are all blank, and you can then fill in the names of all the different results that you do. So for example, you just type in hemoglobin, you give it decimal or text, and then you add it in, and it goes down here to the bottom, and you can, if you know what the ranges are for min and max, you can fill that in if you fill it in as decimal. So these are all the different results that you will need to have filled in for your results. If you have any more that's not in that list that you do, you can fill that in. So you can use this exact same investigation for just general surgery use. You don't need to necessarily use it just for the chronic disease management. So I have that created, and then what I do is I go into the patient's chart, and the example that I have is John Roberts. He is, what age is he? He is 79, and he's a GMS patient. I have already filled in a baseline. So day one, what happens is the nurse or the phlebotomist, or if you have neither of those in your surgery, the doctor sees the patient day one, and he or she can take all the basic information about the patient, their weight, their height, their BMI, do they drink, their pulse rhythm, etc. And then you can add that into the chart. Then you would you can review your information, you can look at your notes, you can look at your prescriptions, etc. And then to do the chronic disease visit, you go to care protocol. Oh, sorry, I have to do one thing, it's important. I need to begin a consultation. I go to care protocol. So I filled this in earlier, I just wanted to get done before we started this. So care protocol, and you go to chronic disease management. So from here, I click on add review. So there's a registration, and at the same time as registration, there's a visit. So add registration. And at this stage, what's coming up is you've got your review date, which is today. You choose ethnicity. This is bringing in the fact that this patient has been registered with asthma. It's brought in the note from the patient's chart. If I go in here to John Roberts, go into his notes, I can see he's down as being an asthmatic. So when I go to add review, you can then, if you realize that you haven't actually registered the patient as having diabetes or heart failure or anything like that, you can just tick it here, and then you need to fill in what year it was done. And you can fill in any other condition that you know that they have, and any other the information down here. And those aren't mandatory. So if I click OK here, it's now opened up the registration. And if I go back into the notes section, it's actually linked up that I have said that this patient is an active diabetic. So it brings back into the notes, so it codes it for you at the same time. So day one, as I was saying, the nurse, doctor, phlebotomist will be taking the bloods, and it's also you've done the BMI. So from here, it's actually automatically brought in the patient's height, weight, pulse rate, rhythm, etc. And it's saying down here that there's 23 fields that need to be filled in. That's mandatory for the two conditions that the patient has. If there was other conditions, the main one that you have to do most of your bloods on is a diabetic, so I chose that one. There's less for other conditions, like you don't really have to take much bloods for asthma, for example. So you just fill in the visit that you can. So if you're doing this stuff here on visit one, you can just fill it in, and when you hover over this, it says field required. So it's here. You don't need to fill that in if you don't want to. Last 13 months, yes. So pretty much I'm just filling in the information that I can.
And
so I won't be able to...
Sorry, just a quick question. Do the conditions have to be in active or past history to be automatically brought in?
They need to be an active condition for it to automatically come in. I'll just show you here. I can go back into the chart by clicking on John Roberts consultation here. 1 second now. Just go to notes. Well, I can't do it right now, but it'll bring in to say that they're a diabetic in here when you go back into their chart later on.
Right.
So it has to be an active condition.
Right.
Yeah, so you can fill in all the stuff that you can. You can do your fill this in. Smoking status, never. Alcohol risk score. So if I click on this, how often? So your audit CTO. So how often do you have a drink containing alcohol? 2 to 3 times a week. How many How many drinks containing 10 milligrams of alcohol do you have on a typical day when drinking? So 5 to 6, that's a lot. How often do you have 6 or more drinks? And they say weekly. And it's calculated their risk score. So they're high risk of 8. So that will come back in here. So that's mandatory. If I click here, for example, and click on the little arrow to the right of that, it will bring me to the relevant information that's important. So I can go thyroid function, and it'll bring me straight to that location. So I'm just going to go back to the top here. In a typical week, how many days do you do? I'll go 1 to 4. If you have 4 or less in a typical week, have you been? Yes, so you fill it in. It will bring in the vaccines in the patient's chart. So if you've done an influenza vaccine with the patient, it will bring it in. If you've done a pneumococcal one, it'll bring it in, and at what date you've done it last. So from what I understand, the pneumococcal, you don't have to give it every year. It could be 4 or 5 years ago that you gave it, but you still need to reference that the patient got pneumococcal back then, at the pneumococcal vaccine. So I can't, has the patient ever had an ECG? Yes. The ECG result, what is it? And I'm not going to be able to fill in the rest of this stuff today because I am sending off my bloods. We're going to pretend that these aren't filled in. So you fill in all the stuff that you can that day, and then you click save. So the coming week or so, the patient will have to come back in to review all the information, that all the bloods that have come back, and maybe some other stuff the doctor might need to be able to talk to them about, because the nurse will be able to take the bloods and do some of those checks. Then they come in the coming weeks, the doctor comes back in the same way, begins a consultation, comes in here, and then he or she goes through all this information here that is left. So if I just start from the top here and scroll down. So the doctor will come in and see that there's some bloods back. It's automatically brought in these bloods here because it understands it. So this is something that people will find that they won't automatically come in. Example like I have here. The reason for that is there's so many different labs out there, and each lab have their own way of recording bloods. They have different names on things. There's just loads of different ways. Depending on what lab you are, you'll notice that there's just so many different variations of the same thing. So hemoglobin. In this example, I just need to search for hemoglobin. I can search by just clicking on search. It hasn't come back. And if I just go %sign in here, I'll just delete some of it. It's trying to find hemoglobin. Search. No, it's not coming back. So I need to try and figure out what my hemoglobin is called in this chart. So if I go back to John Roberts, go to the investigation section, I can see that he has some bloods back. And as you can see in this example that I gave, there was a non-electronic results. So these are the ones that have come back from the hospital. So if I double click on this, I can see if, no, there's no hemoglobin in there. I double click on this, there's no hemoglobin there. I double click on this one, yeah, hemoglobin. So this one is called HB in this particular example of lab messaging. So I go back in here, I search for hemoglobin, but it doesn't work. So I'm going to go and sign HB and search, and it's returned. It can now find hemoglobin down as HB. So when you're doing this, you just need to make sure that you don't accidentally click on the wrong one, because it's got the same name. So double click on the hemoglobin one, which is HB, double click on this. And then at this stage, it asks you, would you like to remember this selection for next time? So you're going to say yes to that because you want to remember that your electronic result coming back is called HB. Then what that means is, say yes to that. Your lab in your area calls it that. So any other patient that does a chronic disease management visit thereafter, that they'll know that HB is hemoglobin, and it will automatically bring in that information. So this is the first time we're doing it, so it doesn't understand that's your hemoglobin. So if I just go HDL cholesterol, I click on the button to the right because it's a mandatory one, and I can't find it. So %sign. What this means is when you're looking for something like HDL, it might be called, in your lab, it might be called cholesterol-HDL or something like that. So if I call it HDL, it's going to be able to find it. When you say HDL here, normally it's looking for the word starting with HDL. Whereas when I go percent sign, it's looking for HDL anywhere it appears, any part of the word. So if I click on search there now, and it's found HDL. So double click on that one. Would you like to remember this selection for next time? And you would say yes to that if it's an electronic result. But I know in my example that this HDL is not one that's coming back from the lab. So I don't want it to remember it this time round because it's not, it's just that this patient happens to have no electronic messages back. This is their ones that they've gotten back from the hospital that you've manually filled in. So I'm going to say no to that. So you search for this again for the next one, percent sign search, and that, and fasting glucose. Let's find that one, no, that one. So let's find that one. And ACR. I know that I don't actually have an ACR result. Some labs just can't calculate that, so they can't send it back. So where it says NA, that doesn't mean it's what you would normally expect to be to say not applicable. It actually means not available. So that means it's not available to give. So if they weren't available for these ones, you can say not available for those. And then you just scroll down. Education provided by the GP. Yes. So agreed written care plan. So the care plan is something that you can get the patient to use. So agreed written care plan, yes or no, or declined. So you can choose what it is that you want. So down here at the bottom, I've got 2 more fields to fill in. Medication reviewed. So when you're reviewing your, you want to review the patient's meds. So you can do that by clicking on the view button to the right to go straight into their prescription section. In my example, I don't actually have any prescriptions in here, but you'll see them all there. So then you can go back in here and you can say, yes, I reviewed them. At that scenario, you might realize that the patient needs to get the prescription, you know, to print it off then. And then the last one, if I click on the little arrow, CVD score. Oh yes, the CVD score up here at the top. So CVD score, it's brought me back up here. And if I click on this button here, it's calculating the ages 79 female. It's brought in this information. Sometimes it doesn't bring in your total cholesterol. So if it doesn't, you just need to search for total cholesterol and bring it in. Same with the HDL cholesterol, it might come in. So it's calculating the score. You can check these boxes if they apply and you click OK. So I have filled in all this information here. There's no other mandatory fields. So what I can do is I can click on save. That's saved, and now I can submit it. So it's going to go through HealthLink. So just to note, on my computer, I have a test HealthLink certificate. So it actually takes like 40 seconds for the one to submit. This doesn't happen for you on a normal basis. So you click submit, it gets sent off. What happens is it goes through HealthLink, and then there's 2 parts to it. You'll get a response back, but you won't see it actually happen to say that the PCRS have received the actual message. The second part is your clinical message. So you mightn't get that back for a while. So as long as you get the response back to say that you have got first message, which is just that you've sent the information to the PCRS, then you'll get paid for that. And then when you'll get the second message back with the clinical data thereafter, everything is processed. So this is just sending. I was doing this earlier and it took a while. I couldn't get it to go any faster.
Always the way.
Yeah. Okay, so that's sent off. And over here on the left-hand side, you can see it's awaiting acknowledgement. So for this example here, I am going to do a follow-up visit, or sorry, not a follow-up visit, I'm going to do an interim review. So two things that I've just done, or one thing I've just gone through so far. You can only bring in the bloods if they were done in the last 3 months. Before that, you'll have to do your bloods again. The interim review, which we'll do next, it needs to be at least 4 months after your initial visit, your annual visit. And then next year, you'll do your annual visit at around the same time as you have now. So I am going to close this here. I just want to close all that. And then I want to go back into him. So this is 4 months later. And when you go into the notes section, you'll see from earlier, the patient is now registered as diabetic. So I'm going to begin a consultation, and I'm going to go to your protocol, and I'm going to go to chronic disease management, and you will do the same thing again. So add review, and I'm going to just forward date this just so that we can actually see it actually happen. So I'm going to go to going to go a few months ahead. And if you then find out that they've actually got some other condition that has happened or you've come across in the meantime, you can mark it off in here, and you can say when you found out this information, and you say okay to that. And then you basically go through the whole process again. In this example, so the nurse sees the patient, or the phlebotomist or the doctor sees them day 1. Then the coming weeks, they come back and the doctor reviews the information and then sends it off. So you really you generally see the patient 4 times. So day 1 on the annual visit with the nurse or whoever is taking the bloods and doing the BMI, etc. Then the following weeks after that, the doctor will see them again to review all the information and submit it. Then their interim review, which is around 4 months after that, you do the whole process again. Bloods, BMI, what you can take day 1, a few weeks later, see the doctor, save the work and submit it. So yeah, we'll do that one. I just want to also show you this time around the care plan. So under the information about care plan, so you can submit this and then do your care plan afterwards. From here, you've got, it says that they're type 2 diabetic, they're asthmatic. It will bring in the prescriptions if they have any. Have you any concerns regarding your medication? No. Issues discussed with doctor about your medication? Yes, if there was any. What concerns do you have in relation to your health? Whatever the information is that you want to say. Are there areas of your health that are good to have improved? I started doing more exercise, blah, blah, blah. Other things that matter to you, whatever it is. What do you do to manage your condition? Eat an appropriate diet, yes or no? Information. So all the mandatory fields has an exclamation mark. You don't have to fill all this in. So you can fill it in as you go, and then you can type out the information that you want to talk about with the patient, or the patient wants to talk to you about. And then health services you have referred to today, you might want to send them to a dietitian or whatever it is, smoking, etc. You tick what you want, and then you can go save, and then you can print this off, and it just goes through the information that you filled in, and you can, yeah, so you can print that off, and the patient can get handed that. So that is the interim review. So you just do the same thing again around the following year. Next year, you just go to your first visit, second visit, and so on. So the next thing that I want to show you is, so if I go to communication, sorry, my bad, my control panel, claim tracker. So you send off all this information through HealthLink to the HSE. And at the same time that the person downloads your bloods, when you download your bloods on a computer, it just doesn't download bloods. It downloads your out of hours messages, your e-referral responses, your e-search response information, and it does loads of things. It just doesn't do your lab messages. So what happens is the information gets sent back through HealthLink, and then what happens is you can check to see the status of your visits that you've done by going under Control Panel, Claim Tracker, and over on the left-hand side you can click on Chronic Disease. So in here I have the different statuses. So this is incomplete ones. These are unsent. So these are actually finished, that no one's just sent them. In here, you got a waiting acknowledgement. So these are the ones that we need to take a look at. So for example, here is John Roberts. This is the one that we did earlier, and these are some other ones. What happens is, so as I was saying there, when we were submitting it, it comes back in two parts. So the information gets sent off through HealthLink to the HSE, and they say, yeah, we've accepted that, and then you get a claim ID back. Then over the coming weeks, days, you'll get another, this will leave the awaiting acknowledgement section when you get when they process your clinical data. It will leave here. So just because it stays in awaiting doesn't mean that they're not doing anything. It just means that, or that you have done something wrong. It's just that they haven't sent back the clinical data yet to say they've got it. Once it goes, it'll either go into accepted, or for some reason it might go to rejected. So if I go under rejected, these are some that have been rejected. If I go over here, if I hover over that one, it says GP does not have the CDM contract signed. Basically, they haven't signed their contract to say that they want to join up with CDM. So what they have to do is they sign their contract. You can come back in here then thereafter, well, when it's all processed, you can go into their chart. What's handy about this is you can go into the patient's chart from here. You just have to double click on them and then begin your consultation, go into, and you can do what you need to do then. So go to care protocol, go to chronic disease management, save your visit, and then you can submit it then. So you don't have to do it all again from scratch. You just have to save it and then submit it. When you're in here, what's also quite useful is when you, as I was saying, the patient needs to come in a few times for all these visits. So day one, the nurse, the doctor, phlebotomist is going to see the patient and do all what they can. And then coming weeks, the doctor sees the rest of them. So you can see what still needs to be done. So the people that need to come back in, so you can see when they were done. So the doctor, or we then know we can book in an appointment for Sean, and you can go into his chart from here. You don't have to go into consultation, begin consultation and go in that way. You can double click on it here. So Sean Adams, I've gone back into his chart from here. So that's pretty useful. And what else? Is there anything else that I need to tell you? No, that's pretty much it.
Excellent.
Yeah, that's pretty much it.
That was brilliant. Thanks a million. That was really comprehensive. We've had a good few questions in, and we'll try and get through them as quickly as we can. I suppose, first of all, when will this be available for everyone, or how is it being rolled out?
Yeah, so we can't just send it out like with any update. We can't send it out to everyone all at once for many different reasons. But what we're doing is we're starting to do a kind of the major rollout come next week. There's going to be a new version out in the next day or so, and that's people will start getting that one. It just kind of covered the people that have been using it have just come up with little things that they feel isn't right or there's issues with it. So the new update fixes those. Right. So yeah, so come next week we're rolling it out to start doing a big rollout to people.
And you'll know that you have the update by the Socrates 2.702 up in the top left, is it?
Yeah, so this one says 2.7.0.2, so the new version will say 2.7.0.3.
Okay, great, great. And can you edit a CDM registration in there?
Yeah, so in my example that I have, I am not able to do that.
Okay.
Let's see here, John Roberts. But in the 2703, you can.
Okay.
Otherwise, what people have been doing is they have had to delete the registration. So they've gone in here to so they've added the review, and then they've had to delete it. Make sure you want to delete this, yes. And then they've had to add it again and fill it in. So in the newer version, you'll be able to edit the registration. So the ones that everyone will start getting, you will be able to edit the registration.
Okay, great, great. And how do you know when a patient is due for recall?
So that's reports that we don't have as of yet, but they will be in the coming weeks, months. So it'll be before you will start needing to call them in.
Okay.
You'll be getting new reports that go into the report section.
And it'll just be click on the report and that'll tell you all the patients that are due.
Exactly. Something similar to this. I don't know the exact way it will be, but it will probably be something similar to the cycle of care, where you actually just have a section for CDM and it'll have the relevant reports in there that you need.
Excellent.
For chronic disease management visits.
Excellent. And I suppose just to say as well that there's a huge amount of resources that we've put up on socrates.ie/resources. So we have a training video, we have FAQs, we have quick guides as well. So if we don't get to your questions today, they might be in there. And if not, then look, contact us and we'll be happy to answer them as we go.
You can also, sorry there, Donald, you can also access the website by going into those videos and manuals by going to help and going to online help, and it will bring you straight to the Socrates website. And from here, these are the manuals that Donald is on about. There's the chronic disease quick guide, there's the chronic disease FAQs, and from there, if you run that there, if we open this one, just because I'd imagine some people might want to know what ones to come in. On this here, it's answered some of the questions, and down at the very last one, what reports can I find to find eligible patients? There's certain reports that you can run, and there's some examples that you can use to try and find out all the people that need to come in for a visit. And in here, you can see what codes are for what condition that they need. And also, so yeah, on this here, so there's the quick guide, there is the FAQ, and then if we scroll down, these are where our videos start. So there's two videos here, chronic disease management overview, and then the chronic disease mapping lab messages. So that's pretty much what I've gone through all of that in this webinar. So what you can do then thereafter is, if you want to watch back on this, you just go to YouTube and go to Socrates Lunch and Learn, and it will be up on here. And this is where all our other webinars get posted.
Excellent, excellent. And if the chronic disease is already under past medical history and not an active condition, will it pick it up?
No, but what you can do is when you tick it in the patient's chart, I'm nearly sure it doesn't. I can test that. I can't test it here. But what you would have to do is you would just tick it, and it will make it an active condition in the chart.
Okay, excellent, excellent. And again, this might be more a question to put to the HSE than ourselves. But do you know if the guys would need to get the patient's signed consent to commence CDM and for the release of their medical information? Or do you know how that would work?
I'm not too sure on that question.
Okay.
Yeah, the HSE might be the best one to go there with that you suggested there.
No problem.
Not too sure the answer.
And if a lab puts in the HB under a whole suite of results called hematology, is it possible to index that and put it in as a separate item, or not?
Say that question again, sorry.
Again, yeah, just reading it here. If a person's lab puts a HB in under a whole suite of results called hematology, can this be indexed and put in as a separate item?
Okay, I'm going to answer a question. I don't know if it's this question that I'm answering,
Okay.
but I think I understand what you're saying. So in my example here earlier, I think this is what they're saying. If I'm wrong, then just let us know, and they can even just call the desk later on. I might be able to work out better what the question means. Under this investigation, the one that I had in here, I think it was this one. Yeah, this one. The HB was in an investigation called TGHFBC old. I don't really know what that is, but anyway, if that's the name of the result. So if your one is called name hemoglobin, and in your actual information it's called HB, you would just it's pretty much the same thing. That one, if we just pretend that one says hemoglobin, you'll be able to find it when you find out what the name of it is here, which is HB. I think that's the question.
Okay, yeah, not 100% sure, but look, if you have further questions, feel free to ring into the support desk, and the guys will be able to help you. And again, you might be able to answer this one, but I'll ask it anyway. Do you know what the schedule of visits is? Like, for example, is the first visit bloods and then visit 2, or do you know that level of detail on it, Louise?
I know that. So visit 1. When you're registering somebody, for example, you do a lot of stuff for diabetes. You don't, as I was saying earlier, you don't really do much for asthma. So when you do the initial registration with diabetes, I know there's a good few blood results, but their second visit, there's less things that you have to fill in. Their first visit, their annual visit, you have to fill in more blood results, but their follow-up, their in terms of your review, they don't have as many to do.
Okay. Fair enough. And can a GP registrar add the details and submit, or do you have to hold a HSE contract? Do you know?
You can technically submit it, but the doctor is probably going to want to review the information with the actual patient. Technically they can, but the doctor would want to probably go through stuff with them, like their diet.
Okay.
They might want to do their care plan with them. What else? Just basically talk to them about what might make their life better, make their illness better managed. So technically they can, but they'd want to see the doctor to go through all the information that they get back.
Okay, fair enough. And look, just time for one more question. Do you need to register patients with the PCRS as a CMD patient in the same way that you would with the cycle of care?
No, that's actually a really good thing about this. With the cycle of care, it was a lot more awkward. You had to have on your computer, you needed to have a PCRS cert and you needed a health link cert. So the PCRS cert was needed because you needed to check if the patient was actually registered as a diabetic or registered as an asthmatic for kids. So you actually had to register all that stuff on the PCRS. So with this time around, it's just going by your GMS number. It does a kind of a check as you go to see if that number is valid. So yeah, you don't it's a lot easier. You just need a health link certificate. Actually, there's one thing that is important as well that I forgot to mention. Sure. Is if a patient, because you brought up cycle of care, if a patient is over 75 and is diabetic and has been doing a diabetic cycle of care, then you don't do a diabetic cycle of care. You do their diabetic visit through the chronic disease management. So you don't use the diabetic cycle of care anymore if they're over 75. And also, if you use the heart watch section in the system, so where am I? If you use cycle of care or if you use heart watch, you just don't use those anymore for over 75s. You do it all through the chronic disease management.
Great.
That's just you just do an extra work and it's pointless. So do it all through the chronic disease management.
Excellent. And I know I said one final question, but we just have one more coming in there. Is the Q risk calculator going to be available in Socrates generally?
Not as at the moment, but I would foresee, but don't take my word for it, that it will be in the baseline details section eventually. But it's just at the moment it's not in there. I would imagine that it would go in here might go somewhere in here instead, but at the moment it's not in there, but hopefully in the future it will be in there.
Okay, brilliant. Listen, Louise, that was absolutely fantastic, and I appreciate that there was a huge amount that you had to get across there. So, look, thanks a million for that. Hopefully, everyone found it very useful. As always, this will be up on YouTube with all of our other webinars. And again, just a reminder to check out the resources page on Socrates that we pointed out earlier if you have any more questions. Hopefully, you all found it useful, and thanks a million for joining us today. Thanks very much. Bye bye.
Perfect. Good luck. Bye.